Hey, it's Jessica DaMassa with WTF Health. I'm here at the Together.Health event at HIMSS 19, and joining me right now I have Hayley Hovious. She is the president of the Nashville Health Care Council. Hayley, it's good to have you.
Thank you so much for having me.
Oh my gosh, so explain the Nashville Health Care Council, because this is cool. So you guys are like a convening body that are bringing together healthcare ecosystem players from across Nashville and elsewhere to talk about some of the bigger problems in healthcare. So explain a little bit about how you guys are set up, who exactly you're pulling into the conversation, and what kinds of fierce conversations you're having.
Great, yeah, that was really a good way of summing it up, because the Healthcare Council was founded about 25 years ago by the CEOs of the major hospital corporations that existed in Nashville. And now our ecosystem has somewhere around 500 healthcare companies with an additional 400 service providers working in healthcare. But at the time, it was very focused on just provider. And we're still provider heavy, but we've seen the ecosystem changing so much. Nashville's Healthcare Council has been bringing that group together for a long time. But in the last 8 years, we've recently launched a program called our Fellows Program, which really does bring people in from across the country and from across the ecosystem, senior leaders out of payers, providers, health tech, trying to talk about all of the issues that we have in healthcare, break down the silos that they experience every day, and kind of really take ownership of their part in what's happening in healthcare today, with a cohort of people who are high level enough that they can actually make a change and have an impact on the future of the industry.
All right, so what kinds of things are these folks talking about when we lock them in a room and make them talk to each other?
Boy, we start the first day with something called the Burning Platform, which starts looking at the
sounds awesome. I love it already.
We really bring them low. We bring them really low.
Set them
initially.
on fire.
We basically do, and we just say, this is really a problem for our country, for our society, and we've really got to figure out how we deal with it. And there's a lot of talk about the system is just misaligned. Incentives are completely misaligned. What do you do about that? Because that's really hard. People are working and doing the best they can from across the spectrum. If you look at payers and providers, we're a provider town. I work with payers all the time, though, because they're part of our ecosystem, and the council welcomes everybody because we want to have those discussions. But each side does have their own challenges to deal with, and everyone's just trying to do the absolute best they can within the confines of a system that is really, really structured terribly. So that's part of the discussion. What you really think. Yeah, that's part of the discussion. But I do feel like everyone's doing the best they can.
Yeah.
And by convening them in this way and really highlighting some of these issues, we give them a chance to talk about ways in which they are having a part in it and ways that they can do better. And then often what we're seeing are collaborations from people that go off to start new companies, that take things back to their organizations and change the way that they're doing their business and looking at their business. So that's where the real excitement comes in.
I want to hear some advice then, because you're not alone. I mean, I think especially here at this event, this Together.Health event, where we're talking about knitting together all of the disparate ecosystems across the country. So we're talking about bringing Nashville together with Detroit, with Seattle, and then all of the government players and the big tech companies and the big payers, and I mean everybody, right? But at every level, the level that you're at, give us some advice for others who might find themselves in a similar situation, whether it be in a room full of 4 people or whether it be in a room full of 400 people. How do you have that conversation to talk about payment model, incentive alignment? How have you learned any good tips?
I had the answer to that question, actually.
Any good tips?
I think the thing about it, one of the things that makes me feel fortunate to be in Nashville is that there's really a sense of communal, this idea that a rising tide raises all boats was a long time established. It was far before I got there, but the idea that the council actually keeps people in this mode of, okay, how can we make things better in our ecosystem for everyone? And that we're the keeper of that sort of culture within the city and within healthcare as it continues to grow, because it's growing exponentially with companies coming in, with new players entering the market. But I think the thing is, keeping the patient at the center of it has to be the discussion, because really in reality we're all patients. This is personal. This is our parents, and this is our kids, and these are our siblings, and this is us. We're all dealing with a system that is broken. When you go into a hospital and no one knows who you are, or you go to your primary care physician, they don't know anything. I can send an email across the world in a matter of seconds, but I can't get my medical records any other way than fax. So there's a reason we're at HIMSS. There's a reason that we're all coming together, and I think if you put the patient at the center, it gives us all an opportunity to unite around something.
I understand that completely. The WTF is why the facts. I don't understand. Right?
Why are we still doing that? And I really believe that everyone can come together, but I wish I had the magic bullet to make it work, because boy, it seems like it should be more simple than it is.
I would say, like, I want to ask you this, and just, I guess, anecdotally, in one of those conversations, did you, like, that you've been having, did you feel like one or like some part of it went really well that you could pass along some, like, you know, I guess, like, nugget of advice, or just even tell us, like, share with us, like, the story behind that, like, where did you feel like maybe you've made a breakthrough in terms of talking with payers or providers or both of them about how we get past this, you know, the lack of price transparency, or the problems with incentive misalignment, like we said, or even just like the use of like such antiquated technology, because it's like it's built into a process flow that they just can't undo. So have you felt like you've made a breakthrough?
So I don't know if it's that I've made a breakthrough. I think the culture of Nashville, there's a group called the Center for Medical Interoperability that formed from the providers coming together, and this is a consortium of all of the big Nashville. So HCA, which is the largest in the country, but you have Ascension as part of it. You have all of the big Nashville companies. Ascension, you have a lot of the smaller academic medical centers, Mayo, that type of thing that are involved in it. But they all came together and are really said it is important for us that you have interoperability within the four walls of the hospital. So creating a reference architecture for medical devices so that they have a two-way information exchange is really important, and they've all come together to do that. And it's centered in Nashville. They're working on building the reference architecture and that type of thought process, because that really is centered around the patient. I mean, if you go into a space where that kind of two-way information exchange isn't happening, that's patient lives right there. Yeah. So that type of thing, they centered in Nashville for two reasons. One, there are a lot of their big players are there, but the other one is they just would go to other cities, which I will not call out, but they found that the medical community and the healthcare community wasn't willing to talk to each other. Okay. And that was different in Nashville. Now, it's not easy. There are still competitive issues happening all the time, but I think for the most part, there is a sense that we can all come together and do something bigger, and that kind of thing, it makes me excited.
I want to talk real quick, and last thoughts from you on this is about Together.Health. So it's like, here we are at this event, and so they've just kind of rebranded this initiative that used to be the Digital Health Collaborative, and now it's got a bigger purview. It's still focused on health IT and on data and creating standards around that, but as far as like why you've decided to come and like be part of this conversation here, it's like when you are having like this little microcosm experience, but actually like broader than data. It's more about patient and payment and all of these things. Why come and participate in something like this? Like, what need do you see that an organizing entity like Together.Health is going to be able to contribute to helping, I guess, bring more alignment to the ecosystem?
So I actually talked with Nick really early on in this process about something we were trying to pull together at the same time they were pulling stuff together, bringing everyone into a conversation where we thought that sharing and working together was going to make a difference. And so I've been with him from the beginning, talking to Stefan about this, because the opportunity really is to connect neighborhoods. You know, these neighborhoods of healthcare, there's so much that we're all working on. It's such a huge industry. I think competition's out the door on this stuff. You've got to collaborate because the problems are so huge. Yeah. And so the opportunity to bring people together, we're all experiencing similar things, and it's just much bigger than all of us.
Awesome. Well, Hayley, thank you so much for talking with us. It's a pleasure to have a conversation with you and hear all about all the great things happening in Nashville. Thank you. I'm Jessica DaMassa with WTF Health here at Together.Health HIMSS 19. Thanks for joining us.